Hi, my name is Alana Rubenstein. I'm a nurse practitioner student at George Washington University. What's your name?
Daniel Adler.
Oh, great. It's nice to meet you.
Very nice to meet you too.
What brings you into the office today?
I'm just here for my yearly checkup.
Okay, great. I'm going to get my hands washed and we'll get started.
All right.
All right. Are you comfortable in here?
Yeah.
Okay, great. All right, just a little rundown. I'm just gonna start by inspecting. I'll take a look at your head and we'll go from there.
Okay.
Okay, great. So if you can just look at me. Perfect. I'm gonna go ahead and observe. I'm looking for symmetry, hair distribution, size, color, contour. I'm gonna go ahead and palpate now, is that all right?
Sure.
Okay, great. So I'm just feeling for any lumps, any bumps. Any tenderness in there?
No.
Okay, great. All right, you can continue looking at me. Now I'm going to look at your face for symmetry, all those things I mentioned before, skin color, temperature. Good. All right, can you smile for me? Good. And frown? Okay. And wrinkle your forehead? Puff out your cheeks? Okay, awesome. Just testing some of your cranial nerves. So now I'm going to check for sensation in your face. So you can go ahead and tell me when you feel this, okay?
Okay.
Good.
I feel it.
Good.
I feel it.
Good.
Yes. Yes.
Awesome. Just going to adjust this real quickly. Okay, great. Moving on, I'm going to feel for your TMJ, which is right here. Can you go ahead and open and close? And clench? And side to side. Good. Now I'm going to feel for your lymph nodes, okay?
Okay.
All right, so I'm going to do your preauricular, postauricular, anterior cervical, posterior cervical, occipital, submandibular, tonsillar, and then we're going to go down here to your supraclavicular. Great. Okay, continuing on, I'm going to look at your eyes now. So just looking at the hair distribution in your brows and your lashes, looking at the color, I see you got green eyes, your sclera, cornea. I'm going to palpate now. Your external eye and then your lacrimal ducts bilaterally. No drainage or swelling.
No.
Good, that's good. Pull this down. We're going to look at your conjunctiva, which is pink. Okay, great. Moving on now, I'm going to do some visual tests, okay?
Okay.
So I want you to look at me and follow my finger, okay?
Okay.
So, there you go. Good. Awesome. While the lights are still on, I'm going to have you read this for me. I'm going to hold this 14 inches from your face. Do you have contacts or glasses?
No, ma'am.
No. Okay, so just read this line here.
372646.
Great. Looks like your vision is intact. I'm going to go ahead and just dim the lights for us. And we're going to take a look here. Let me make sure my light is working. Perfect. So I'm just going to look from the side, looking for a red reflex now. Good. And now I'm going to bring this up close and I'm going to look and do a fundoscopic exam, okay?
Okay.
Okay. Awesome. Turn the light back on and we can continue with the eye exam. So I'm going to have you look at me and cover one eye and tell me what number I'm holding up, okay?
Okay. 1, 2.
Good. Other eye?
1, 2.
Awesome. Now I'm just going to check your peripheral vision.
Okay.
So just keep looking forward. Tell me when you can see my hands.
I see him. I see him. I see him.
Great. All right. Moving right along, I'm going to feel over here for your temporal arteries, okay? And just let me know if there's any tenderness. Any tenderness?
No.
All right. Now I'm going to do your frontal and maxillary sinuses.
Okay.
Okay. Any tenderness there?
Not at all.
Great. So now I'm going to go ahead and listen to the temporal artery as well. Good. All right, moving right along, we are going to go to your nose. So I'm just going to visualize right now, looking, okay, great. And I'm going to change the head of this so I can take a closer look up your nares, okay?
All right.
All right, have you had any drainage from your nose recently?
Nope.
Okay, great. So I have a disposable head on here, and I'm just going to take a quick look. So you can lean back your head, please. Thank you. All right, looking turbinate, septum, any drainage or pus, crusting. I don't see any evidence of that. No deviated septum. Go ahead and lean back again. Thank you. All right. Perfect. Everything looks good in there.
Yay.
All right, I'm going to switch out this head because soon I'm going to need it for another exam. We're going to test your olfactory, your sense of smell, okay?
All right.
All right, so I'm going to have you close your eyes and cover one nostril, and you're going to smell two different things, okay?
All right.
All right, so go ahead and close your eye. Cover one nostril. Okay, take a sniff. All right, what does that smell like?
Smells like alcohol.
Correct. Can you cover your other nostril? Great. Close your eyes. Take a sniff.
Ooh,
What does that smell like?
cinnamon.
You're right.
Yay.
That was also checking the patency of your nose, which was perfect.
All right.
Okay, we'll move along and we can do your ears now.
All right.
So first I'm just going to observe both of your ears, looking for redness, crustation, anything like that. I don't see anything. So now I'm going to feel. Just let me know if there's any pain when I pull on your pinna or the tragus. Any pain in there?
Nope.
Great. All right, so now that we have felt, let's just take a quick look. So I'm going to pull up and back and come in here. And right now I'm looking at your tympanic membrane, which is a nice pearly gray, and I see the cone of light, which is exactly what I want. And I'm going to go ahead and do that on the other side, up and back. In. All right, this one has a little bit more earwax in here, but I see the cone of light and it is pearly gray. All right, I'm going to go dispose of this. Perfect. Now I'm going to do the whisper test. So I'm just going to come behind you and whisper a number, and you just tell me what I say, okay?
Okay.
Great.
74.
Good.
63.
Good. All right. Now I'm going to do what's called the Weber test. I'm going to make a noise and put this in the center of your head, and you let me know which ear you hear it better in, or if you hear it great in both.
Okay. Sounds good in both.
Awesome. Now I'm going to do the Rin test. What I'm going to do is I'm going to place this behind your ear on your mastoid, and what we're going to do is then you tell me when you can't hear it anymore, and I'm going to bring it in front of your ear, and you let me know if you can still hear it, okay?
All right.
All right. Start over here.
Can't hear it anymore. And I hear that.
Great. That means your air conduction is better than your bone conduction. I'm going to do it over here as well.
Okay. And I can hear that.
Awesome. That's great. So moving right along, now I'm going to assess your mouth. First thing I'm going to do is just sanitize my hands and put on some gloves, since I'm going to be up close and personal, getting a good look to make sure there's no thrush or erythema in your mouth. Okay, so I have no head on this. Perfect. Just going to go ahead and take a quick look. So if you can, I'm just observing your lips first. I don't see any obvious deformities, no dryness. If you can now open up. All right, we're going to take a closer look. Can you stick your tongue out for me? Move it left, right, up, down. Okay, great. Can you say ah?
Ah.
Awesome. Retracted just like I want. This is going to be using it. All right, now I'm going to help lift your tongue. So can you stick your tongue out again? Okay, can you swallow while I'm here? Okay, no, you swallow with your mouth open? Okay, all right. Now I'm gonna look underneath, around. I don't see any thrush. All right, lift up. Good, I just wanna make sure I'm noting all your teeth. I see that they're in good condition. You can put your tongue back in. Your gums look good. Now I'm gonna have you stick out your tongue again, or I'm gonna check your gag reflex, okay? And so let's just go. Okay, good. That's intact. Perfect. We're gonna move right along now, and I'm gonna take off my gloves. Put them over here. Wash my hands again. And I'm gonna take a look at your neck now. So I'm noting I don't see any masses, your thyroid is midline, no tracheal deviation, and I don't see any skin folds. So now I'm gonna feel for your carotid pulse.
All right.
On both sides. We do it at separate times because we don't wanna occlude your throat. Perfect. I'm also gonna listen here. Good. Perfect. All right, I didn't feel any masses or did you have any tenderness there?
No.
Great. All right, so while we're here, I'm gonna have you shrug your shoulders against my hands. Good, that's checking another cranial nerve, number 11. I'm gonna have you put your neck up and down, left and right. Had to think about that one. Okay, moving on to your lungs. If you could go ahead and unbutton your shirt, I can take a quick look. All right, so I'm just gonna observe first. Your skin is warm. Okay, no obvious deformities. Good, and now I'm gonna go ahead and palpate. I'm just gonna check your ribs. Okay. And I'm gonna do a tactile firmness, so I'm gonna ask you to say 99 when I put my hand against your body. Okay?
99.
Good.
99. 99.
Good.
99.
Thank you so much. Next, I'm going to listen. And you can just sit tight, take a deep breath. Exhale. Good. Good. Perfect. Last one. Nice. Now I'm going to have you say 99 again while I listen with my stethoscope.
99. 99.
Good.
99. 99.
Awesome. Thank you. And I actually forgot to percuss, so I'm going to go ahead and put that step back in. I apologize for going a little out of order. And I'm just listening to your lungs. You hear that sound? That is hyperresonant because your lungs are filled with air. Great. And the last part of this is going to be whispering 99, okay?
Okay.
So when I get this towards you, you can just go ahead.
99.
Perfect.
99.
Thank you.
99.
Good.
99.
Thank you so much. All right, now if you don't mind, could you please take off the rest of your shirt? If you want something to cover your body, I have that.
I'm good.
Okay, great. All right, so now I just want to listen to your, yes, exactly, lungs from the back. And so if you don't mind turning so I can get to your back. Thank you so much. All right, so first I'm observing, great. I'm going to check your expansion here. So can you go ahead and take a deep breath for me? Exhale. Okay, thank you. Now I'm gonna go ahead and palpate your ribs. Good. All right, moving on. Now I'm gonna do tactile firmness on your back, okay? So just go ahead and say 99.
99.
Good.
99.
Awesome. Now I'm gonna percuss like I did on the other side. Just a light tap there. And now I'm checking your diaphragmatic excursion. And so I'm gonna go down here, just keep breathing normally. And I'm listening for where the hyperresonance becomes dull. It was right here. Okay, and then do the same thing on the other side. Okay, right here. Now go ahead and take a deep breath for me in and out and hold it when you breathe out. Good. All right, so this is the difference on this side. All right, and there it is on this side. Great. Now that we've done that, I can move on to listening. So I'm just gonna have you take a deep breath for me when I put my stethoscope to your body. Good, one more. Now you can go ahead and say 99.
99.
Good.
99.
All right, now we're gonna do that one more time, but whispering this time.
99.
Good.
99.
Great. Now, if you don't mind, you can put your shirt back on, and I'm gonna have you move back over here so I can listen to your heart. I'm having you move so that way we can be at a 45-degree angle. You can just leave it open so I can still visualize your heart.
Okay.
Okay, great. Thank you so much. So the first thing I'm going to do again is observe. All right, and I'm going to be looking at your JVD over here, and I don't see any visual palpations, but I'm just noting it, okay?
Okay.
Now I'm going to look at the rest of your heart area. Perfect. And right now I am going to feel for any heaves or lifts. Good. Have you had any chest pain or anything lately?
No.
Good. All right. And now that I've done that, I can go ahead and take a listen.
Okay.
Well, first things first, I'm going to feel for your point of maximum impulse. So I'm going to have you turn to your left. Okay, perfect. You can come back. And that is at your 5th intercostal. And it is past your midline. So I just wanted to say right over past the nipple.
Okay.
All right. Now I'm going to go ahead and listen first with my diaphragm, and then I'm going to have you sit up and I'll listen again with my bell.
Okay.
So I'm going to, at your 2nd intercostal. Good. Nice, strong S1 and S2. And can you lean forward while I do this one? Great. Lean back. Good. And then. Really great. Now I'm going to flip it over, do it with my bell. Just breathe normal. Nope, you're good. Breathe normal, sorry. Do you think it's gone? Okay. All right, and when I get to this point, I would like you to lean to your left, please. Okay, great, you can come back. And once again, I just meant to sit you up, so I'll go and do that part again, but I was checking for your point of maximum impulse. Just do that quickly over. Usually we do this for 30 seconds each, but for time constraints. Good. All right, you can go ahead and button up your shirt. All right, thank you, Mr. Adler. Is there anything else I can help you with today?
I think that's it.
Any questions?
Do I seem pretty healthy?
You do seem pretty healthy.
Thank you so much.
It was nice to meet you.
Thank you, likewise.
All right.